It's an absolute pleasure to now connect to our next speaker. So we have here Gaurav Manchanda. Gaurav was actually meant to speak in a session last week about distributed manufacturing because, of course, he's, director of healthcare at a 3D printing company that I believe we all know, Formlabs, the excellent professional machine that, what's wonderful about Formlabs is that it's a lot more versatile and professional than maybe an FDM printer can do, but it's also very affordable. But the truth is, he was going to be in a VAR response roundtable last week. But when I hinted that we were having this session, he said, well, actually, I also have an international background, a background in international development. I said, this is fantastic. We should have you in the session next week then, because of course, prior to Formlabs, Gaurav spent years in post-conflict Liberia as a special advisor to the Deputy Ministry of Health as part of a Clinton Health Access Initiative, and has numerous experience in this field of medical and humanitarian response. So over to you, Gaurav. Awesome that you were able to join today.
Yeah, thank you, Christina, and sorry to Nadine. In the unfortunate spot of following her presentation here. It was a very interesting talk, but thank you for having me, and thank you for the flexibility with joining this session instead of last week. It looks like I'm in very good company. As Christina mentioned, background in international development and technology transfer into resource-limited settings. Spent a few years in post-conflict Liberia, working with the Ministry of Health on their really the rebuilding effort for the health system shortly after the war had ended, and I did some consulting with the U.S. Development Agency and a few other nonprofits for energy ministries and health ministries across sub-Saharan Africa and Latin America, and then worked in Kenya and China and a variety of other countries while running my own company for about 5 years before Formlabs. I joined Formlabs about 3 years ago as the first medical-focused hire, and I have a few slides to show. Be happy to talk about distributed manufacturing another time, but it's really a joy to be connected with some peers or colleagues on the line here. So I'll just share my screen for a moment and say it's good to hear that folks might be familiar with Formlabs. For those, just give me a thumbs up if the screen is showing or if the screen is being shared.
Perfect.
Yes. Okay, so quick disclaimer slide. I'll skip over a lot of this, but as Christina and some other colleagues have mentioned, we are a manufacturer of professional and affordable SLA 3D printers, so you can get a bit more performance out of our machines than some other print engines. And the mission of Formlabs, which is here, expanding access to digital fabrication so anyone can make anything, essentially democratizing access to high quality 3D printing, was really what drew me from my development and tech democratization background to Formlabs. I have some personal stories as well with people in my own family benefiting from 3D printed orthotics and things of the nature of the like. So for another time. So for those who don't know us, we were started back in 2012 here in the US out of MIT, and have had a range of printers over time. We've become the market leader with about 50,000 of these printers, or 60,000 of these printers sold around the world, including sub-Saharan Africa and India and East Asia. The SLA print engine allows our customers rather to print things like medical models based on CT or MRI scans, or a wide range of other applications using our materials library. So just for sake of time, since I think we're already a little bit behind schedule, I'll go pretty quickly here. But a wide range of applications in medicine, and I just wanted to show you a bit of how we got to where we are with our COVID response. So these surgical planning models and patient consent models that came from CT or MR scan data. That application has been fairly widely adopted in the US and in other regions around the world for clinical and surgical applications. But since about mid-March here in the US, I know the timing has been different for every region around the world, but mid-March was when it really started getting very serious here in the US, and we started seeing more requests, as I think everyone is familiar with on the line, more requests for items related to the supply chain shortages. We met, Nadine mentioned test kits, Pulab mentioned test kits as well, ventilators and the like. So because of the footprint that we had, that I alluded to here, because of the footprint that we had in hospitals already for during pre-COVID times, we had many of our current customers or pre-existing customers come back to us saying, how can we help? Or here are some ideas, here are some designs. What do you think? Can you help us with design, with prototyping, with some free samples that we can try out in the lab before clinical trials, et cetera. And we really, this is all pre-COVID, but if we, just to summarize our business model, before COVID, we were 100% focused on providing 3D printers and resins. Our print preparation software is free. So, but during COVID is when we started really becoming more of a design and prototyping and engineering partner and thinking through these challenges that we're all facing with our clinical partners. And I'll share a few different tabs here, but we ended up seeing the most demand from clinicians. There were thousands of ideas floating around the internet, but the most demand from clinicians for things like swabs, critical component of the test kit, different components of ventilation systems. Thankfully, these weren't really needed in the end of the day. In the US, our ventilation system capacity increased thanks to the initiatives from Ford and GM and large companies that pivoted their manufacturing lines. PPE components, of course, was a big one, and then accessories, which I'll call non-clinical accessories, so things that your average user could print and deploy or use in his or her home or community center, for example. So to Pulab, I believe you mentioned that Nepal was importing swabs and doing some testing. So we were, I think, the first 3D printing vendor to have a swab pass this is the NP swab, so it goes all the way up the nasal cavity. And when you do that, it shows an accurate test result, even if you are not showing symptoms. So as opposed to the simple nasal swab that just goes to the edge of the nose. So within, because of the customers that we had across the US and elsewhere, two of those hospitals actually started talking to each other directly, saying, we both have these machines, we both have these resins, what can we do to address our supply chain shortages together? And how can we have two hospitals testing and validating as opposed to just one? It builds more credibility within the community, and it kind of eliminates user error and any anomalies that might take place in one lab versus the other. So Northwell Health, this is the largest health system in New York State. In the US, New York State was the hardest hit state in the US. So a very dire need there. And USF Health is in South Florida, which actually didn't have much of a need at the time, but saw what was happening in the country. And it turns out that now, 3 months later, Florida is getting hit pretty hard. So they do have a need for these fairly urgently. So these clinicians at these institutions went from initial design to sending us those initial designs, receiving optimized build platforms back. So we received an STL with one swab on the build platform, and we sent back an STL with about 340 swabs to print at one time. So that helps with throughput because these are very high demand, high volume requirements. So we went from initial design, prototype, and then the optimized high throughput design to then the emergency institutional review board at both locations, to lab testing, and then clinical testing all in a matter of weeks. I'm talking about maybe 3 weeks end to end from initial design to the end of the initial stage of the clinical trial, which was enough for them to start printing thousands and thousands per day and start using those in their facilities. As a few of the other panelists on the line mentioned, there are kind of changing requirements and changing stances from legal bodies, regulatory bodies, and hospital-based quality teams are also catching up to the to the changing requirements across the board. And I will say that we were very impressed with the amount of interaction that we had with the FDA, the U.S. regulatory agency. They were very supportive and fairly and transparent with what they were thinking. And we all came to realize that the FDA doesn't actually regulate these devices, but everyone was looking to them for input. So we were kind of in this interesting limbo period with hospitals looking for FDA statements, but the FDA saying we don't typically make statements on these devices. But in any event, we do have the clarity that we need. And importantly, at the end of all of the testing, these two researchers across 2 institutions found that these swabs performed as well or better as the traditional alternative. And those traditional alternatives were manufactured in northern Italy and in northern Maine in the US. Northern Italy was dramatically affected. They were one of the first regions to be affected by COVID, and the factory essentially shut down. So this was one of our more publicized applications. And I think now we're, by the end of the year, we anticipate having well over 10 million swabs printed by hospitals and by government health agencies and used for testing around the world. Formlabs ourselves, we've printed a little bit under 1 million, but it's showing you that the decentralized distributed manufacturing approach is accounting for the vast majority of these swabs in use in the field. So again, dozens of hospitals and government health agencies printing them directly for their populations. So it shows the power of essentially sharing a digital file and an appropriate level of instruction. I'll go a bit more quickly through the other components, and instead of showing slides, maybe I'll skip over to our webpage in a moment. But other categories that I mentioned earlier were the ventilation system components, so things that could convert more readily available BiPAP or CPAP machines into functional ventilators. We received an emergency use authorization from the FDA for this. We were the first 3D printing company to ever receive an EUA from the FDA. It kind of shows you how quickly they were willing to work together with industry. These were used by well over 100 patients in New York in lieu of traditional ventilators that were not available. And then, out of necessity, we saw innovation such as ventilator splitters and other items that should only be used in a last resort scenario, because not much testing has been done on these components to date. Even lab-based testing has to be taken with with a grain of salt. And there are a number of considerations. Patients need to have similar conditions, all be COVID positive, have similar ventilation requirements in order to share one ventilator. So there's a lot of complexity and risk in this category, but we saw a lot of these going around the internet. And the ones that we link to and the ones that we photograph were designed by medical centers, by doctors, either tested in the lab or used in the field if necessary. And I'm sure we all saw the news about the snorkel adapters. This was widely circulated fairly early on, but we did see not only the initial group in Italy, but groups from the Mayo Clinic in Minnesota, one of the best hospitals in the world, showing their videos on Twitter to hospitals in Spain and hospitals here in Boston, where Formlabs is based, all taking their own approach and modifying snorkel masks and scuba masks that were locally available and modifying the adapter slightly to the point where they were safe to use clinically. And one last one in the clinical section, this was an oxyframe, or essentially a facial shield visor that also I was able to pump air through the frame in order to create a ventilated hood. So this was designed by a clinician at Yale. We have who's obviously using this in his own during his own shifts, and we do have these parts on our website. So we put together a little COVID response page along with some of the considerations for printing safe medical devices. We want to make sure that people are doing this responsibly and safely. And we really looked at the range of applications in two categories, one being for medical use, meaning only medical device manufacturers or point of care manufacturers should print these. There's often a sterilization or a biocompatibility or airflow requirement. And then the community use is more for, these are non-patient contact or they're much lower risk items that anyone with a 3D printer can consider printing. So within, I'll just wrap up in a minute here, but within the medical section, you'll see the swabs, the or the ventilator splitters with the file available to download from the medical center that designed it. The BiPAP adapters, that file is available from Northwell Health, the designer of the BiPAP. There are a range of PPE adapters available for download and shields and the like. So that's the medical section. And then on the community area is where we make it a bit easier to access the STLs or the form files. So for the shield I was just mentioning, seen here, there are photos, of course, but then some instructions, the actual manuscript itself from the clinician about how to print these safely and effectively, an assembly video, and the STL file is available here. So, we wanted to do our part as really a hub of information and as a recipient of thousands of emails from doctors and volunteers around the world. I will point out that we had well over 5,000 individuals with 3D printers volunteer access to their machines for clinicians around the world. We encourage people to go to our website and sign up if they want to join that community. But other items that are not on our page, but where 3D printing was used, I think people are familiar with these applications, but our machines were used to create prototypes and some end-use parts for different ventilation systems themselves. I mentioned the sleep apnea or the CPAP conversion. This is a PAPR device, so another form of PPE made at another teaching hospital in the US. And keep in mind, these are just the US initiatives. We have designs and users from all over the world. These are just the ones that we're most familiar with. And for those not familiar, the last thing I'll share here today is just to make sure that people are aware of the 3D Print Exchange on the NIH, the National Institutes of Health website. You can see the link up above. But this is a great collection of parts that have been reviewed by clinicians at the VA, which is the largest health system in the United States. Clinicians have reviewed these files, actually printed them and used them and tested them. And for the ones that have been reviewed for clinical use, that's been the process that they've passed some sort of standard or testing by a clinician. You'll see most of them are in the PPE face shield category, or the adapters and the ear loops. And then for the community use, these are lower risk, haven't been tested by anyone, but there's no need for a clinician to test a door or a button pusher, for example. Just want to make sure people are familiar with this resource. I'm sure that most of you are, but we do have a number of applications that will be posted here in the coming days. And yeah, as Christina mentioned, with my background in public health and humanitarian response, I was in Liberia as it was shifting from humanitarian relief to development, and I'll just say that a lot of, given the amount of time that we have right now, I'll just say that a lot of the skills and experiences that I faced while in Liberia were very helpful in managing this crisis. You know, this was done mostly from a laptop and not from a Ministry of Health building, but it just required a lot of coordination and consolidation of information and prioritization. So if you're thinking about, you know, a post-war country that doesn't know, at that point we didn't know how many clinics there were, how many health workers there were, because all of the money went from let's say the U.S. government to a nonprofit that then delivered the services. The ministry's on the side of that whole process. So it was very important to just have some frameworks and some sort of national level project planning experience to coordinate all of the demand and interest that we received. So happy to share more offline, but thank you for the time.
Thank you, Gaurav.